Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and we are in for a real treat this morning because we're visiting with Dr. Helen Torok, who is Dr. Helen Torok of Trillium Creek Dermatology and Surgery Center. So good morning, Dr. Torok.
Morning, Janie. Pleasure.
Oh my gosh, always a pleasure to see you. I'm always want to know what you've been up to. So this is perfect. Yeah. So first of all, tell us about Trillium Creek Dermatology and Surgery Center.
So I started Trillium Creek in 1978.
Wow.
Imagine that, how small Medina was. I started actually in Akron as a dermatologist with another dermatologist, but you know what? I lived in Medina, and I said to myself, why don't I practice in Medina? The community that I love, the community where I live, serve my community. So after 9 months in Akron, I decided to open in Medina. And of course, my peers laughed at me.
Because you were coming to the farmland.
You're coming to cow country. You're never going to see humans. You're going to see animals. You'll be a veterinarian, a dermatologist at a vet, like a vet clinic, right?
Sure.
I said, well, I'll try it. I'll give it a try.
Okay.
So here we are, 47 years later.
Oh, my.
Booming.
Yes.
20 providers seeing patients, offering everything from on the skin from head to toe, all right? And anything that concerns you, we have it. Because my goal was not only to serve my community, but to offer every device, every opportunity, every treatment, cancer treatments in your community. You don't have to go anywhere. People don't like to travel.
They don't.
They want to stay in their community. Give me care here.
Holy, but now you have more than just one in Medina, Trillium Creek.
So there are 5 locations. Medina was the first one,
Okay.
Worcester was the second one, and then Wadsworth, Brunswick, and now Strongsville. So we can serve a large part of our community.
Holy smoke. Give me a rundown of some of the things that you can do for someone when they come in.
So we do a lot of skin checks, head to toe.
Okay.
Because remember, 1 in 5 Americans get skin cancer. 1 in
Yikes.
5. And every hour, one of our Americans dies of a malignant melanoma every hour. All right?
Yikes.
So skin checks are very, very important. I don't care how old you are, right? So that's very popular. But we also offer a lot of psoriasis treatments. We have lasers for psoriasis. We have lasers for eczema. And we have wonderful, wonderful new drugs for psoriasis and eczema, which is a heartbreak for everybody, right?
Yes.
And we do what is called a Mohs skin cancer procedure by Dr. Bayless. That is a microscopically controlled under a microscope, so every cancer cell is gone. There aren't too many of those in the country, so we're fortunate to have one in Medina. All right? And then we do mold checks. We take molds off. We take warts off. We see infections, whether it's a virus, shingles at our age, right?
Right.
Warts in kids, that's a virus. So we do a lot of procedures and a lot of treatments.
You are so well known in the region.
Almost 50 years.
Yeah, sure. Let's hope so.
Yeah.
No, you are so well known. And if you say to somebody about, I went to Trillium Creek, I've been there. In my family, we've all been there.
There's no concern that is too small or too negligible not to address. If it worries you, bothers you, come in, we'll take care of it.
I'm a firm believer in all over bodies skin check.
Absolutely.
And a lot of people have told me that they get nervous because you have to take your clothes off.
Well,
I don't
we
know.
don't have x-ray vision. I wish we did.
Well, if something were happening there, you'd be taking your clothes off anyway. So to me, it's like either pre or post.
Right.
Yeah.
But, a lot of practices will just look at a spot. Show me a spot, open, No. We take everything off. In men, skin cancers are common on the back. So unless your spouse is looking at you every day, how do you know? That's why you have to take that shirt off. In women, a lot of them on the legs. Shorts, skirts, dresses, you know.
Sure.
So yeah, you have to undress everything.
I had some things going on in my arm, and the sweet lady that I worked with there, one of your nurse practitioners, she said that oftentimes they will see that because of your arm on driving the car.
Exactly.
Yeah.
So 65% of your precancers and skin cancers are on the left side of the face and left side of the body because of the exposure through the glass window. That's long-wave ultraviolet. You don't burn, but it damages deeply.
You probably stay out of the sun completely.
Didn't used to, though. Remember, Janie, years ago, we would just sit out there like everybody else.
Yes. And, and I remember people just dousing themselves in baby oil, and they would fry. Yeah,
But who knew? Who
Yeah.
knew you could get skin cancer from that?
right.
We didn't know.
No,
Now we do.
right.
And what do the kids still do? Tanning beds.
Oh, boy.
So popular.
Yeah, especially before prom.
Homecoming, prom,
Yeah,
whatever. Yeah.
everything. I wanted to ask you, where did you go to college, and how did you decide dermatology's for me?
So I've been very blessed through my whole life. I came to this country at the age of 10 from Germany. We were immigrants. We were displaced people. And we were fortunate that the Catholic Charity sponsored us. So we came to Cleveland. We were supposed to go to Argentina. We came to Cleveland.
Okay.
And went to high school, college. Case Western Reserve gave me a full ride. I've been blessed, I'm telling you. You know?
Wow.
Right.
Wow.
And then fortunate enough to go to medical school at Ohio State, the Ohio State.
Okay.
And when I was in medical school, I was going to be an obstetrician gynecologist. You know, there were 215 of us in medical school, only 10 women. So I thought, I am going to save the women. I will be their obstetrician gynecologist. There weren't very many. I've got a aha moment, got a rash in medical school. I saw a dermatologist, chief of dermatology. Helen, you have this, and this is what you have to do. And I said, wait a minute, take an x-ray, take a biopsy, take something, got a bad rash.
Do something.
He said, well, you took 2 weeks of dermatology in medical school. 4 years, you get 2 weeks of dermatology. 3,000 diseases.
Oh, my.
I said, I hated dermatology. Did I? I said that.
You did say that.
Helen, I'm going to make you respect dermatology. I don't want you to like it. I want you to respect it. He changed my program to 2 months to spend with him in dermatology. Canceled my residency application, said, you will learn dermatology. And I never looked back. And I have been in love with it from that day on. There's nothing better. You can see it, you can touch it, you can feel it. And you can change somebody's life.
Boy, isn't that
You
the
can
truth?
change somebody's life.
Mm-hmm. And I was thinking too that it would seem like to me to be a physician going into it, not so much anymore since they've been doing different things like hospitalist and things like that. But it would seem like you could have a life and be a dermatologist.
Yes.
That you could do a little bit of surgery.
Yes.
Yes, seeing
Yes.
your patients, but you
Yes.
could have a family life.
Yes, and that's really the quality of life today is very important. But you can see them from cradle to grave. We see them all, every age. So if you like geriatrics, you'll be happy with all the patients. I think my geriatric patients, to me, are the most rewarding.
And why is that?
Because their problems are more serious.
Okay.
Yeah, they're more serious. They're on so many different medications. They have side effects from the medications. They get shingles, they get infections, they get cancers, a lot of cancers. And you can spot skin changes from internal cancers. So you can really spot things early.
And you have never stopped learning.
Every month I get 12 journals
Oh
that
my
you have to study.
gosh.
12
Yes.
different journals. And there's something new all the time.
And you have so invested in new technology.
Mm-hmm. If it's out there and it's beneficial and it'll benefit our patients, we get it. We're not owned by private equity. We are not owned by some business out there, which a lot of practices are now being bought out.
Sure.
But there you have to get Yes, you can buy this. No, you can't buy that. That's too expensive. That's not good. No, we don't want it. We have to make money. No. If the technology is good, we'll pursue it and actually bring it into our practice.
And you know, a lot of times when you go to a physician, you feel like his or her hand is right on the handle to zoom out to the next patient, and you never feel like that at Trillium Creek.
You know why? Because we have so many assistants who are helping us. Behind us, the scenes assistants are helping us. The assistants in the room are, all that costs money. Yes, my overhead is higher, but at least I have happy patients.
Boy, and you do.
Well served. Yeah.
You do. Everything about Trillium Creek to me is so professional, and it just feels good. It feels like you're welcomed there, and you feel like you're in with the new technology, and that's so important.
Yeah. We also have this team culture. All our providers who are seeing patients, we communicate with each other. We help each other. We can call each other, say, listen, what do you think we can do here? So we have 20 active minds looking at your problem, which is wonderful.
Boy, and how many physicians do you have on staff?
Oh, I think we have, I've never added them up. We have 20 seeing patients. We have nurses, physician assistants, and then the doctors. Yeah.
Boy, I tell you that from somebody who thought that their friends thought that they were going to be doing dermatology on cows.
Yeah.
That's pretty impressive.
Yeah, we have 150 employees.
Wow.
In the 5 offices. The big thing is the behind the scenes staffing, to bill your insurance company, to make sure we get pre-authorizations. If we have to get something expensive for your psoriasis, some of our drugs cost $100,000 a year. I have 4 women constantly working for you, pre-authorizing with your insurance company, so you get the drug. And if the insurance says no, you know what we do then? We go for the patient assistance program that every pharmaceutical company has. That takes a team. A team that works for you.
Boy, that does.
Isn't that something?
Yes, because I've gone to physicians in the past, and I didn't know I was going to get such a big bill, that something wasn't covered or it was partially covered. And it just takes you back when you open the mail and it's thinking you're going to be like $20.
Yeah.
Yes.
Yeah.
And so that's wonderful that's all part of your team.
Yes. That's our important part. That makes us successful and get you the right treatment.
And unique.
And unique. That's
Yes,
true.
and
That's true.
Now tell me exactly why it is that you love what you do. Take out the Trillium Creek part. Why is it with patients that you love what you do?
So, I've been in practice almost 50 years. And every day patients go, when are you retiring? I can't fathom retiring because I get such satisfaction when I see a bad psoriasis patient and they come in there. We cry together because I got the right drug at the right price, right? I can't imagine retiring. I enjoy this way, way too much. I get such a thrill from clearing even my acne patients. They're severe. They're depressed. Their self-esteem is horrible.
Yes.
And you clear them up, and they're just totally different people. So that's what I look forward to every day. I can't imagine not seeing that every day, enjoying the thrill of clearing somebody, of making somebody happy. A teenager who's happy. Teenagers, they're tough.
They are tough.
Yeah.
And boy, even when I know myself, I didn't have acne per se, but when you get a pimple, you just feel like hiding.
If you've never had one.
Yes.
That one will get you.
Yes.
Yeah.
And then to think that you have an entire face of it, that's so, to get help like that, it has to be wonderful.
I'll give you an example. I saw a little girl this morning. She's getting married Saturday. Last Thursday, she got hives.
Oh, no.
From a medication she was taking. Head to toe hives. Her wedding is in 10 days. She's red, swollen, blistered, itching like crazy. She came in today, hugged me, and what I started her on, she can go to the wedding and not be red and swollen. But that's what makes my day.
Oh my gosh.
You know?
How wonderful.
I know. She's getting married.
And probably not itchy either.
No itching as of today.
Yes. Yeah. So that's because the whole thing would just be devastating.
To a bride.
Yes.
My gosh.
Yeah.
Yeah.
Holy smokes. Now, as far as your schedule goes, do you go to all of the different offices?
So I go to Medina, Wadsworth, and Worcester.
Okay.
All right. And I work 5 days a week. On a Wednesday, I usually train, come in and do teachings, educate my staff. Yeah.
Another thing that makes Trillium Creek unique.
We train our physician assistants for 6 months before we let them out and see any patients. Yeah, 6 months. And if they don't quite finish in 6 months, we go a little longer. But we want to make sure that they are comfortable and that they are very, very good at what they do.
Well, you're like a textbook, of how to be successful, truly, and to go after your passion, because I can see this is passionate for you.
This is my passion, and I'm grateful every day for it, every day.
Oh my gosh!
Yeah.
And so, and it's very easy to make an appointment.
You can do it online. Mm-hmm. You can call us. We have virtual sessions also, virtual appointments, but you can do it online. Call us. Yeah.
Now, do you think you'll be opening any more centers?
Good question. So I get that asked all the time. What's your next location? I think for now 5 is pretty comfortable.
It seems like that's a lot.
Yeah.
And you have to have just the right people in there managing.
Oh my goodness, yes.
So,
yes.
Oh my gosh, you just warm my heart that you have found exactly what God put you here to do.
And he did.
Yep.
He's been guiding me this whole time. This whole time. And I am grateful.
That is wonderful.
Yeah.
So I'm going to stop because I could talk to you for 4 hours. So Dr. Helen Torok from Trillium Creek Dermatology and Surgery Center, thank you. Thank you for all you do. And not only all you do, but you support our community and every community you're in so well.
Yes, we
and
really
boy,
do.
We really appreciate that.
We really do, yes. So we like to give back to the people that support us.
Oh, that is
give back.
Just music to my ears.
Yeah.
Yes. So thank you.
Thank you, Janie. Well, you've been doing this a long time.
You are watching WCTV, Wadsworth Community Television.